Congratulations, you just had the Secure Smile procedure done, and here's some information to help you understand what your next steps are and how to take care of things. First of all, with the sedation, what pretty much everybody does, they go home and they go to sleep for a few hours, and that's totally normal. And when you wake up, typically people remember kind of bits and pieces of the procedure. Some people remember the whole thing, some people don't remember walking in the door. Everybody's different on that. So there's definitely some amnesia associated with the medication, and that's normal. Now, what I want you to do is take some ibuprofen and Tylenol together. Now, we gave you some at the beginning of the appointment, but about 6 hours after that first dose, you can take another dose, which on a typical size person, about 2 to 3 Advils, which is 3, Motrin, Advil, that kind of thing. That's 200 milligrams each. The one we gave you in the office is 600 milligrams, which is 3 Advils, plus 2 extra strength Tylenol. The research has shown that that combination is an excellent painkiller, actually works better than Vicodin, which is what we used to use. Now, for some people who cannot take ibuprofen, then you're probably going to have to go with the opioids, and we've given you a prescription for that, and you can take that up to 4 times a day if you need to. Be sure to have some food in your stomach when you take any kind of narcotic pain medication, or to avoid throwing up, which is no fun. As far as what to expect, there's going to be some discomfort. We've usually removed a number of teeth and placed implants and sutured things together. Now, the pain medications help with that. Stay on the antibiotics until the bottle is empty, and just as it says on the label. If we gave you a prescription for a steroid, then go ahead and take that as directed, as written on the bottle. That's usually a 3-day dose. Now, as far as gauze in there, if there's any teeth that were removed that are typically behind where the teeth go, you can put some gauze on that to help control bleeding. Some oozing and bleeding around the edge of these is normal. That's not a problem. Excessive bleeding, it could be an issue. If you have a history of you taking blood thinners, or if you take aspirin, that can cause things to bleed a little bit more. It's rarely a big deal. You can take some gauze and wrap it around. You can't bite on it because the teeth are in the way. You can take some gauze like a little hot dog and wrap it up underneath on the outside and keep a little pressure on that for a bit if you need to. A good home remedy that actually works is to have a tea bag in there. Take a tea bag, soak in a little cold water, wrap one of these gauze around it, and put it in the area where the bleeding is happening. That is very good at stopping bleeding. It takes really 15 to 30 minutes of the gauze in there, and that usually dries things up. Now, as we've probably said 100 times, no chewing. Right now they're for looks only. It's pretty much a liquid diet, very soft. Scrambled eggs, mashed potatoes, stuff you can mush around with your tongue. We'll get there. You'll be eating steak before we're done, but for now, it's very important for the stability of the implants to don't do any vigorous clenching or chewing on them and overstressing of the implants like we've talked about. Many people experience a feeling of some tightness where it's all kind of hooked together and the bone's not really used to that for a while. So, some people experience a feeling of some tightness in there. That goes away. And as far as speech concerns, there's this, plastic on the inside where your tongue, makes sounds. That can be a little bit weird at first. Everybody gets used to that. If it's an issue, then a good way to do is just sort of take a book and practice reading out loud and just speaking out loud, and just practice. Your tongue will figure it out. We put dentures and things in people's mouths all the time, and everybody accommodates to that. So it's typically not a problem, but at first it could be a little bit weird. If it's an issue, then we can talk about it, and sometimes we may have to make some adjustments in that. We'll do some bite adjustment at the next visit. We did some adjustment this time, but you're all numb, so that may not have been too accurate there. So we'll see you at the post-op visit, and any questions, give us a call.